Hi, my name is Amy. Welcome back again to Health Focus. And this is the channel that you'll get all details concerning health. Again, every single time I keep on saying that we are going to measure all professionals in health. But today we have friends of the health sector. They have worked in the health sector until right now we can give them a title in relation to the 17 cadres in healthcare, or rather, let us divide healthcare and put that department into the healthcare space. It is project management. She is my friend. She's an amazing worker. She's an enthusiastic project manager, right now heading the entire county in healthcare. And welcome her to set the way we welcome people here in Health Focus. Welcome, Stella.
Thank you, Emily.
Kindly introduce yourself to the viewers.
Thank you, Emily. I'm so delighted to be in your channel today, Health Focus. And my name is Stella, as she mentioned, Stella Jane. And I am a project manager by profession. I am heading a project in Kiambu County by the name Vision Impact Project. I have been in this space for the last 11 or so years, or counting. Thank you.
Wow. So in the pillars of healthcare, where are you strengthening it from?
Nice, good question. I term myself in the project management and development space, like we are touching in all aspects of health, right from financing to service delivery. It is a combination, I call it a combi, because project management is right from the planning up to the end of what you're doing. So you cannot be able to mention one department and one pillar and leave the other pillar. So right from financing, because we have in the donors and development partners who bring in the funds, the resources that we may require as health professionals, service delivery where we bring on board health professionals to offer the services that the people may require, right from the Wanjiko, everywhere, right from primary care up to healthcare, up to the tertiary healthcare, all through. We can't work without project management because it's a development area, it's a development space, and including human resource, because we have our partners who come in to train and capacity build our already existing, and maybe just to ensure that we are keeping abreast with emerging issues. So case point scenario is the COVID times when everything came in and we didn't know what to do, and we saw a lot of development work and project management. In fact, agile project management was working in there because no one knew what to do. We all came in, tried to do on ground anything that could be done. And yes, that was project management for those who do not know what project management is.
I would like to ask a question. How does a day of a project officer in a health setup look like?
Our project management office is quite busy because you are always implementing what you planned, because project management has a cycle from planning to implementation to execution to monitoring and evaluation and then to the closure. So I have a meeting with my team members just to plan the day and to ensure what their KPIs and ensure that we are tracking their KPIs as per it should be. Then engage stakeholders from different areas. Maybe if I'm working with the county or the national government, ensure that I need to give feedback if there was something that was required, ensure that we give communication on where we are in terms of project, because it's important in project management to keep your stakeholders informed, especially after you do your stakeholders management and analysis, just to know who is more important in terms of stake and what they need from you as a project or as an institution or organization. So after I'm done with that, every activity that had been planned for the day that includes maybe patient related or ensuring that I'm following on feedback or anything, I ensure that I complete on that. I get into the interface of the patient, because there's a time that you need to meet your beneficiary and just ensure that you do everything as it should be. And after I'm done with that, then I look at the lessons learned. I document everything that I'm supposed to document. And as I close my day, I ensure that I make a plan for tomorrow, a to-do list. So the cycle repeats itself. A to-do list, ensuring that everything that I'm planning to do, of course, in between the day, there are approvals to make, maybe payment approvals. Being a project manager, you should be looking at the budget versus the activities that you have in, the activity plan schedule, ensuring that maybe there are people who are coming in so that you ensure you are still remaining within budget and the schedule within time.
So it's such a busy.
It's a busy day. It's a busy day. Sometimes I don't necessarily get to the office at 8. If you're in the project management space, you do not, if you rely on 8 to 5 work, then you will find yourself not doing so many things. So you have to push yourself harder. You have to be proactive. You need to be motivated. You have to love what you do.
Motivated.
Yes.
All right. So what do you think are the qualities that make a good project officer or manager as a career?
Okay. You will not go far, and I confidently say this, if you do not have integrity. So my take home for everything that you do, integrity is first. Remember, you are managing resources versus time. So you have been given maybe, say, 300 million to manage versus activities. It's up to you to decide if this is going to get into the people it's supposed to help or to the activity it's supposed to do. It's up to you. You can do so much within that, but if you do not have integrity, you ought to bring the impact. Then, other than integrity, I think you need to be proactive, as I mentioned before. It doesn't have to be always you are pushed to do things. As a project manager, you should be able to lead a project from within, and you are able to just do things before you actually told to do them. You have to have emotional intelligence, because as a project manager, you are dealing with people. People management is key in project management. And so, these people, you are depending on them, and you have to understand how to deal with people's emotion and make decisions not based on your emotion, and being a good leader and delegation.
So what will you say are the good things and bad things for you in healthcare space?
Being in the healthcare space, I feel like I have really enjoyed this journey, because you are bringing in change that is felt by the beneficiary, and you feel good about it. You are saving life. You are saving someone from a potential disability. You are doing so much. And this, I feel, is something that we need to give a kudos to our medics and our healthcare professionals. And also the fact that we have now started moving from professional kind of based caregiving and to the patient-based care kind of giving. It's something that I really applaud whatever is happening right now. We also need to keep ourselves abreast of the emerging issues, because things are coming up every other day. And now that brings me to the gaps that, or the bad things that I feel, or things that I feel that should be changed in the healthcare. We should always be ready to learn every other day. As a medical professional or healthcare provider, I feel like there are some healthcare providers that do things same old way that our grandparents used to do. And with so many things changing, I think it's good we embrace the changes that are coming in the sector of healthcare. In this case, technology. I think we should embrace technology in terms of providing our healthcare, embrace things like telemedicine, because we are moving. We are not doing things, we are not still in the 1980s way of doing things. We have moved, we're in the 2020 something.
Okay.
Yes.
So in the health space where you are, or what you're doing in the eye health, what are the major conditions that you come across that you support?
In my current project, every day, in fact, it's already here in this room, refractive errors. We are both wearing spectacles, and it's such a pity that out there in the community, people do not take refractive errors seriously. And it's blinding. It causes blindness. And the lack of information for them. You'll find parents saying that their children will not, after a diagnosis has been made and maybe a prescription given to a child, they decline. Yeah, they decline their children to put on spectacles just because they are not educated enough, or they are ignorant, they do not know.
Yeah, educate them. Tell those parents.
Parents, dear parents, I am in this space right now conducting eye health program right from the community, door-to-door screening. And sure to it, in Kiambu County, there's a lot of refractive errors in children. Let me tell you, please allow your children, after the diagnosis, let them get the treatment. As much as you allow medication to be given to them, so should you allow them to put on spectacles, because it helps, and there's a reason why they've been. But do not walk into any optical shop to buy spectacles.
Get a prescription.
Yes, get a prescription. Go see an ophthalmic clinical officer or an ophthalmologist, get checked, and let your children get the right diagnosis. If the doctor sees it right to have them put on spectacles, please allow them. Other conditions, I mean, that I've encountered in my project's implementation, I've encountered congenital cataracts. It's so common. And now that I'm in Kiambu, there's diabetes retinopathy. Yes, there's a lot of, yes, because of our diet, maybe. The central, we are known for taking a lot of starches. There were rules so and so, the potatoes, we love feeding our bodies with that. And I think due to diet, there's also a lot of diabetes retinopathy. And
again, let's tell viewers, retinopathy will lead to blindness.
Yes.
So kindly take care of your diabetes and be checked every year.
Yes, and I think this is a challenge to you. You should bring in a nutritionist so that you can educate your viewers in terms of nutrition.
For sure.
Yes.
For sure, we'll do that. So that is refractive errors, and we have retinopathy and cataract.
Yes.
Those are
a little bit of glaucoma here and there, and glaucoma causes irreversible blindness, irreversible. So let's have this to encourage people. If we identify cases early, that's the project I am currently implementing in Kiambu County or managing. It takes care of the health system, the government health system, how it works, right from primary. And so we are using CHVs to go door-to-door screening and community health assistance, door-to-door screening and from school to school, so that we can identify and pick these cases early so that they cannot lead to blindness. And again, you see now when it leads to blindness, we go now again to visual impairment, disability inclusion.
So is this project running the whole country or a selected county?
It's running in selected counties. So far it's running in 7 counties. Kiambu being where I am based. I'm managing in Kiambu County. 7 other counties, that is Kajiado, Kiambu, Embu, Murang'a, Kwale, and Vihiga and Bomet. But maybe before mid of next year, we'll have it rolled in 3 other counties, so it will make them 10 counties.
If you're not in Kiambu County or in Nakuru County, can you just come into Kiambu County to be checked? And can they log into Kiambu County and be checked as relatives of the Kiambu County?
You see, when I come door to door, I screen the whole population in that household. Okay. So even if they do not reside in Kiambu, I will offer inclusive and accommodate everyone who is in that house in the project.
So people from Kisumu County, Kisii County, your county is not mentioned in the list of 10. Get your eyes checked. If you can't come to the counties that are being checked, get your eyes checked.
Again, I would like to recognize that this project is trying to support health government systems and ensure that, I know it's a rare occurrence for you to walk into a government facility and get eye health services.
Yeah, it's rare.
Yes. So this project is using the big 4 hospitals in Kenya just to empower the government so that they can be able to offer good services. There's a lot of infrastructure that has been put in place, a lot of capacity building, a lot of service delivery. And so after the project ends, we look at sustainability. And that is a take home for every project manager out there. Sustainability.
So that the project doesn't end.
Yes, and the people, our Wanji, will continue getting services as it was intended.
So now in the health space, who is your hero? In your career, who is your hero?
Nationally, I love Jean Madenge. She's the president of PMI, Kenyan chapter. PMI, as I'd mentioned before, initially, is a Project Management Institute. It's a body that brings together project managers. And I love a woman by the name Eva Kombo. She's a gender specialist. I really admire what she does. Internationally, I am in love with a lady known as Lorna Davis. She's a project manager. Yes.
I'd have to be.
Yes, go.
Yes. What is your biggest fear in the health space?
My biggest fear in the health space is wrong diagnosis that can lead to so many different things, because it's happening out there. We see people walking into chemists and just buying medication to treat symptoms rather than get checked. So my biggest fear is to wrong diagnosis, which may lead to ripple effect of maybe complications, and also leads again to disability, which we are trying to ensure that we.
I see.
Yes.
Well, I know in this channel we like knowing the journey. How do you become a successful project manager? Let's go back to where little Stella. Where did you go to school from the beginning to the end?
Oh, nice one. I've never answered this question. I know some of the viewers will make jokes. You went to a group of school. Yes, I went to Nyahururu Light Junior School. That is a school back in Nyahururu, where my upcountry, where I come from, where I grew up in. Then after my Class 8 examinations, On my KCPE, I went to Karema Girls. After 4 years again, I graduated and I went back to where my folks and I were staying. So I went back to Mombasa, down the coast. For my tertiary education, I went for a diploma course. Not because I wouldn't have managed to go for, my grades had allowed me to go for a bachelor's course, but I did not manage for various reasons. We all undergo these problems in back there, you know, finances, not knowing what to do, no one to encourage you what to do. So I found myself doing a diploma. And a funny story is I was not going to do project management nor development studies. I found myself in this space after I was going to do journalism. And that is what I always wanted to do when back in my high school. Once I realized what Stella is, I'm quite vibrant, outgoing, and so I thought I will do well and feature well in the journalism space. And so I went looking for a school with my guardian. And
now, before we go to even tertiary level or call it something, when you were in high school, what you wanted to do journalism?
Yeah, sure.
What motivated you to do that?
I think my personality was one of the things that I really think that motivated me to do the inner calling of myself. But there's also the people that we look up to. I used to see a Julie Gishuru somewhere and I would feel like, oh my God, I want to be like her. And I also loved a girl, her story didn't end up so well, but I loved Esther Arunga. So she used to motivate me so much and I really felt like I want to be like her. I wanted to communicate to the world out there of what is happening. And apparently my career right now somehow intertwines with what I wanted to do.